I'm Amy Allen, and I'm an instructor here at UMA. Today we'll discuss the urinary system, specifically pathological conditions as well as diagnostic procedures relating to this system. Are you ready? Taking a look at the pathology of the urinary system, remember, our kidneys produce urine to eliminate waste from the body. Now, kidney stones may form, and this occurs when we have minerals and acid salts that begin to crystallize and stick together in the urine. If the stone is small, it will pass through easily. However, a larger stone can get stuck in our urinary tract, which will present problems for the patient. Now let's take a look at some of the diseases. Nephropathy. This means any disease of the kidney. Let's break this medical term down. We have nephro, meaning kidney, and then pathy, which means disease. Nephropathy. A person with diabetes may develop diabetic nephropathy, and this is a kidney disease that results from late-stage diabetes mellitus. Next, we have renal failure, and this is also known as kidney failure. This is the inability of one or both of the kidneys to perform their specific functions. When the body is unable to replace damaged nephrons, and when there's way too many nephrons being destroyed, the result is kidney failure. There are different types of renal failure. We have acute renal failure. You may see this depicted with the abbreviation ARF, and this is just a sudden onset, and is characterized by uremia. It's important to note if this condition isn't reversed promptly, it can be fatal. It's also important to note that acute renal failure can be caused by the kidneys not receiving enough blood to filter. This would be due to any dehydration or maybe a sudden drop in the blood volume or blood pressure, which comes from maybe an injury, burns, or severe infections. The next type here is chronic kidney disease, and this is abbreviated with CKD. Also, you may hear it referred to as chronic renal disease or kidney failure. This would be the progressive loss of that renal function over months or years, so over a period of time. The common condition, which can be life-threatening, may result from diabetes mellitus, hypertension, or if someone has a family history of kidney disease. When considering contributing factors, the buildup of waste in the blood from our CKD can be a contributing factor in heart attacks and strokes. Here we have renal failure. Again, specifically end-stage renal disease. ESRD would be the abbreviation for this. This would be the final stage of the CKD, and this condition is fatal unless the functions of those failed kidneys are replaced by treatment such as dialysis or with a successful kidney transplant. Nephrotic syndrome. This is also known as nephrosis. And this would be a group of conditions in which we have excessive amounts of protein that are lost through the urine. Let's break nephrosis down. We have nephro, meaning kidney, and then tic, TIC, pertaining to. Next, we have edema, and this would be excessive fluid accumulation in our body tissues, which can be symptomatic of nephrotic syndrome or other kidney diseases. Keep in mind, this swelling can be in the area around the eyes, the abdomen, or the legs and feet. Next, we have hyperproteinuria, and this is the presence of abnormally high concentrations of protein in the urine. Let's try breaking this word down. We have hyper, which means excessive, protein, easy, meaning protein, and then we have urea, which means urine. Put all the word parts together, the result is hyperproteinuria. Here we have the disease hypoproteinemia, and this would be the presence of abnormally low concentrations of protein in the blood. Let's try breaking this term down. We have hypo, means deficient or decreased value. We also have protein, has the same combining form. And then we have emia, which means blood condition. Often this condition will be associated with hyperproteinuria. Now keep in mind the words seem similar, but they're totally different. With hyperproteinuria, this is the abnormally high protein in the urine, whereas with hypoproteinemia, this has to do with abnormally low concentrations of protein in the blood. Starting with some other kidney conditions, we have hydronephrosis, and this would be the dilation, or you can say the swelling of one or both kidneys. When we begin to break this term down, hydro meaning water, NEPHR, the nephra, is meaning kidney, and then osis would mean abnormal condition or abnormal disease. Putting all those word parts together, we have the term hydronephrosis. Now, this condition can be caused by problems associated with the backing up of urine that may be due to an obstruction from a kidney stone or maybe a narrowing in the ureter. Next, we have nephritis. Breaking it down, the neph again means kidney, and itis is meaning the inflammation. So the definition here would be the inflammation of the kidney or the pair of kidneys. The most common causes of nephritis are toxins, which are harmful to the body, as well as infections or an autoimmune disease. Next, we have polycystic kidney disease. And this is a genetic disorder characterized by the growth of many fluid-filled cysts that exist in the kidneys. Let's begin to break this word down. We have poly, which means many. Cyst, good thing here, has the same meaning as cyst. And then the suffix ic or ic means pertaining to. Now, these cysts, which slowly replace most of the mass of our kidneys, will begin to reduce our kidney function, and this reduction will eventually lead to kidney failure. Looking here, on the left side is the exterior of a kidney with polycystic disease, and on the right you'll see a cross-section view of a kidney with polycystic disease. Here in this figure, we see potential locations of renal stones, or you may hear it referred to as calculi, as they move through the urinary system. So what is a renal stone, or what is calculus? This would be an abnormal mineral deposit that is formed within the body, and it's named for the organ or tissue where it's located. It's important to note here, these stones will vary in size. They can start from small sand-like granules that'll pass through the body easily, unnoticed, and it can turn into stones the size of marbles that can become lodged and actually cause acute pain. Remember from our previous lecture, stones form when waste products in the urine separate and begin to crystallize. Normally, the urine contains chemicals to prevent this from occurring. However, dehydration as well as other factors may disrupt this balance. Dealing with diseases of our ureter, we have ureterorrhagia, and this would be discharge of blood from the ureter. Let's break this term down as well. We have uretero, which means ureter, and then we have rhagia, meaning bleeding. Put those word parts together, we have ureterorrhagia. Moving on now to diseases of our urinary bladder, we have cystalgia. This is meaning pain within the bladder. You may also see cystocele. This is also known as a prolapsed bladder. Here, there's a hernia of the bladder through the vaginal wall. When we begin to break this term down, cyst is meaning bladder, and the cele or C-E-L-E means hernia. Remember, this sometimes occurs as a result of pregnancy or from childbirth. Next, we have interstitial cystitis, and this would be chronic inflammation within the walls of the bladder. The symptoms here are similar to those of cystitis, but they don't respond to the traditional treatment. The next condition of the urinary bladder is the neurogenic bladder. And this is a urinary problem that's caused by interference with the normal nerve pathways that are associated with urination. Here, normal urinary function will depend on nerves being able to sense when the bladder's full, and then control those muscles that will either retain the urine or allow that bladder to empty. When we break down the term neurogenic, neuro refers to the nerve, and then genic refers or means created by. Now, depending on the type of neurological disorder causing the problem, the bladder may empty spontaneously, resulting in incontinence. But in contrast, the problem can prevent the bladder from emptying at all or from emptying completely. This will result in urinary retention with overflow leakage. With the prostate gland, a patient may also experience or be diagnosed with prostate cancer or prostatitis. Now, the prostate is a walnut-sized gland that's located between the bladder and the penis. The prostate is just in front of the rectum, and the urethra runs through the center of the prostate, from the bladder to the penis, and this allows urine to flow out of the body. So when thinking of the prostate gland, this will secrete fluid that nourishes as well as protects sperm. Here, prostate cancer is one of the most common cancers among men. The disease can grow slowly with no symptoms, meaning the patient will be asymptomatic, or it can begin to grow aggressively and then spread throughout the body. You may hear the term metastasize, which means the cancer is spreading from one location to the other. Many times when you have a metastasized cancer, you will have the origination site, meaning where the cancer originated or started, and then you'll have your ending location, meaning where the cancer spread to. Then we have prostatitis, and this would be a group of disorders that are characterized by the inflammation of the prostate gland. This is easy to break up. We have prosta or prostate, meaning prostate, and then we have itis, which means inflammation of. Our urinary tract may also have medical diseases present. We have our UTI, which stands for urinary tract infection, and this usually will begin in the bladder. However, such an infection can affect all parts of our urinary system. This infection is quite common, and it's caused by the bacteria, most often E. coli. It's important to note that UTIs are more frequently found or diagnosed in women because the urethra is short and located near the opening to the rectum. Next, we have cystitis, which is an inflammation of the bladder. Breaking that word down, we have cyst, meaning bladder, and the suffix itis, meaning inflammation. Next, we have polynephritis, and this would be an inflammation of both the renal pelvis and the kidney. This usually will be caused by a bacterial infection that is spread upward from the bladder. Let's break this term down also. We have pyelo, meaning renal. Then we have nephra, meaning the N-E-P-H-R, which refers to the kidneys. And then inflammation, which is the suffix of itis. Put those word parts together, we have pyelonephritis. Now we're moving on to some urinary disorders. We have anuria, and this is the absence of urine being formed by the kidneys. If we were to break this medical term down, starting with an, meaning without, same as a, and then we have uria, the U-R-I-A, which is the suffix meaning urine. Now this condition is often caused by the kidney's failure or either a urinary tract obstruction. We also have diuresis, and diuresis is the increased output of urine. Di meaning through, and uresis meaning urination. The next condition, dysuria. This is commonly associated with urinary tract infections, or we can say with UTIs. When we break this word down, dys means painful, and uria means urination. So put those word parts together, we have dysuria, which is difficult or painful urination. Next, we have enuresis, and this would be the involuntary discharge of urine. In meaning into, and uresis again meaning urination. So we have enuresis. There's also the condition nocturnal enuresis, and this would be urinary incontinence during our sleep. It's also known as bedwetting. Keep in mind, the phrase or term nocturnal means pertaining to night. Moving on to nocturia, notice the same beginnings of the word. This would be frequent and excessive urination during the night. The noct, the N-O-C-T, means night, and then uria, refers to urination. Next, we have oliguria, and this means scanty urination, which can be caused by dehydration or renal failure and possibly U-tract obstruction. When we break this word down, the olig is scanty or little, and then uria is meaning urination, oliguria. Take a look here. We have polyuria. Notice it still has that same ending of uria, which means urination, but poly is meaning many. So with polyuria, this would mean excessive urination and is a common symptom of diabetes mellitus. Note here, polyuria is the opposite of oliguria. Next, we have urinary hesitancy, and this is the difficulty when starting a urinary stream. This condition was most common in older men and also with those with enlarged prostate glands. However, in younger people, the inability to urinate when another person is present is what we call bashful bladder syndrome. So the easier way to remember urinary hesitancy is to think of the hesitance when starting that stream that makes it very light. Now, when we move into urinary retention, this is also the inability to completely empty the bladder when attempting to urinate. Now, this condition may be more common in men and is frequently associated with an enlarged prostate gland. Remember, that enlarged prostate gland may need diagnostic testing to determine if disease is present, such as cancer. Now, as we move from talking about the flow of the urine or the lack thereof, we move into the phrase or term incontinence or urinary incontinence. This would be the inability to control the excretion of the urine, the feces, or possibly both. With urinary incontinence, this is simply the inability to control the voiding of the urine. However, with overflow incontinence, this would be a continuous leaking from the bladder, either because it's too full or because it's not emptied completely. This usually is caused by a blocked urethra and is prevalent in older men with an enlarged prostate gland. We also have stress incontinence, and this would be the inability to control the voiding of urine under certain physical stress, such as running, lifting, sneezing, laughing, and even coughing. But note, this condition is more often occurring in women than men. We also have an overactive bladder, and you may see this abbreviated with OAB. We also call this an urge incontinence, and this occurs when the muscles of the bladder contract involuntarily, even though the bladder isn't actually full enough to know the need to urinate. Now, we have there our urinary sphincters, relaxation, and this occurs in response to the need to urinate. Keep in mind, the purpose of those urinary sphincters are to open and close. Don't forget the definition of that sphincter. It's a muscle-like ring. Muscle-like ring, if I can say that clearly. Now, this condition of an overactive bladder will be seen more in adults over the age of 40, and it may be caused by an excessive consumption of caffeine or alcohol. Also, UTIs may play a factor, neurological diseases, or the bladder, or if the patient has prostate problems. Let's now move and take a look at some procedures for diagnosing conditions of the urinary system. We first have a urinalysis, and this is a test where it's examining the urine to determine the presence of any abnormal elements. Breaking that term down, urine means urine. That's pretty simple to remember. And then we have the analysis, meaning a part or study of the parts. A urinalysis may be used to diagnose certain diseases as well as pregnancies, and then they also detect the presence of certain substances in the system, such as drugs. Next, we have a bladder ultrasound, and this is the use of a handheld ultrasound device, and it looks for stones or elevation of the bladder, which is caused by that enlarged prostate, and then it begins to measure that residual amount of urine that remains in the bladder after urination. If the bladder is described as being distended, this means that it's holding more than the 400 milliliters of urine that it's capable of holding. Next, we have urinary catheterization, and this is the insertion of a tube into the bladder to remove a sterile specimen for diagnostic reasons. It's also used to drain urine from the bladder when the patient's unable to urinate. Another use is to place medication into the bladder, which is one treatment. Below that, we have cystoscopy. When we break this word down, we have cysto, meaning bladder, and scopy or scopy, meaning visual examination. So when we put those word parts together, we have cystoscopy. And a cystoscopy is the visual examination of the urinary bladder with using a specialized type of instrument that we call a cystoscope. When treating prostate cancer, you may have a specialized cystoscope that's used. This allows removal of those tumors or the reduction of that enlarged prostate gland. Patients may also be diagnosed using radiographic examinations of the urinary system. Here we have a cystography, and this would be a radiographic, or you may call it an X-ray, examination of the bladder after that contrast medium is entered in the catheter. Now keep in mind, this would be entered via that urethral catheter. Whenever you hear contrast medium, that's just saying that a dye has been inserted to show the true colors upon microscopic view. So let's break down cystography. We have cysto, meaning bladder, and then graphy, meaning process of creating a picture or a record of. Next, we have intravenous pyrography, and this is known as excretory urography. And this is simply a radiographic study of the kidneys and the ureters. Breaking this word down, pylo means renal pelvis, and graphy, again, means to record, the recording of, or the process of creating a record. Again, we have that same contrast medium that's administered intravenously, or we can say via IV, which means via the veins, and this will define those structures in the image, and that's why we call it intravenous pyelogram. And you'll notice that it's depicted with the abbreviation IVP. This test will be used to diagnose changes in our urinary tract, which results from certain conditions, maybe infections, also enlarged prostate, as well as some tumors. When diagnosing prostate or prostate cancer, a digital rectal examination may be performed on men. Now, this would be using a lubricated, gloved finger that's placed into the rectum to palpate or feel the prostate gland. Now, the purpose of this palpation is to detect if their prostate is enlarged and also to look for any signs of prostate cancer or tumors of the rectum. When you hear the term palpate, this just means the use of touch to examine a body part. We also have the PSA, which is the prostate-specific antigen blood test. And this is a test that's used to screen patients for prostate cancer. It measures the amount of prostate-specific antigen that's present in a specific blood specimen. But the PSA itself is a protein produced by the cells of the prostate gland, and they help to liquefy the semen. The higher a man's PSA level, the more likely that patient has cancer. Today we discussed those pathological conditions relating to the urinary system, as well as taking a closer look at some of the procedures that are used to diagnose patients with certain conditions of the urinary system. Keep in mind, if the tumors are present, many times they must be excised, and the earlier the cancer is caught, the better the outcome for the patient. I wish all of you happy studies. Have an awesome week.